sarcoidosis is a systemic disease that involves first the lungs, then could also involve the skin, liver, bone, the nervous system, and cardiac involvement. The pattern in the pulmonary function test is a restrictive pattern with diminishing the diffusion lung capacity for carbon dioxide or carbon monoxide. The pathophysiology is autoimmune. Actually, in the bronchoalveolar lavage, there is an increase in the ratio of CD4 positive T cells to CD8. There is also overactivation of the alpha-1 hydroxylase enzyme, that is the one that converts the vitamin D to the active form of the vitamin D. So we have 25 hydroxycholecalciferol, 2 by this enzyme, 125 dihydroxycholecalciferol, or calcitriol, that is the active form of vitamin D3. So vitamin D3 increases the calcium. These patients have increased calcium, hypercalcemia, and hypercalciuria. Then the involvement of the skin could be erythema nodosum or lupus pernio, that are some rash in the face that is similar to lupus, but it is not lupus. And there also could be some biliaceous lesions on the skin. The cardiac involvement could be third degree auriculoventricular node block, AB block. The nervous system involvement is Bell's palsy, that is the facial paralysis of the 7th cranial nerve. The diagnosis is, the first step is a chest X-ray that will show hilarious adenopathy bilateral and reticular opacities more prominent on the upper lobes. Then if we find this, if we have suspicion for this, we do a high resolution CT scan. The diagnosis is confirmed with a biopsy of the lesion of the hilarious adenopathy that will show increased granulomas. These increased granulomas need to not be due to other cause, so it is a diagnosis of exclusion. And we could also see on histology Schumann bodies and asteroid bodies. These are calcification, laminated dystrophic calcification. The treatment could be just observation if the patient is asymptomatic. If the patient has a deteriorating lung function, we could give corticosteroids. If the patient is very severe, then we give immunosuppressant therapy like methotrexate or azathioprine or tumor necrosis factor alpha inhibitors. And for something called Lofgren syndrome, the treatment is just NSAIDs. The Lofgren syndrome is the tetrad of a patient with sarcoidosis that has erythema nodosum, fever, hilarious adenopathy, and migrating polyarthritis. This is Lofgren syndrome, and for this the treatment is just NSAIDs. So sarcoidosis is a diagnosis of exclusion. It has involvement of all the systems. The most important is the lung, that leads to a restrictive pattern, And in the pathophysiology, we have the autoimmune component and the increase in alpha-1 hydroxylase that increases vitamin D, and so the patient has hypercalcemia.